What if a single biomarker could predict your mortality better than any other, including your age? A new test available at LabCorp called MVX can. The higher your score, the more likely you may die in the next 5 years. It's predictive of mortality even in 30-year-olds, whether you have cancer, heart disease, or not. Now, this may seem a little far-fetched until you look at some paradoxes, including the fact that while obesity drives certain diseases, very low body weights are associated with higher mortality. While high blood pressure leads to heart attacks and strokes, low blood pressure can be associated with impending mortality. We see the same for cholesterol, and even the more markedly predictive marker of lipoproteins called ApoB, unless you adjust that ApoB finding for underlying nutrition. Which brings us to the complex realm of malnutrition and inflammation, which are known to play a potent role in whether you can survive episodes in life like cancer, heart attack, infection, or just about anything else. There's clearly a difference between intending to lose weight through diet and GLP-1 therapy, or lowering blood pressure with antihypertensives, or lowering cholesterol with lipid-lowering therapy, versus unintentionally losing weight in the setting of cancer or illness. One improves health outcomes, where the other is a sign of worrisome illness. So when some brilliant scientists like William Cromwell and Jim Otvos looked at huge databases of people who had had baseline blood samples stored and close clinical follow-up for many decades, multivariable analysis started to show some interesting things. Instead of using typical chemical assays, they basically did MRI of the blood with something called nuclear magnetic resonance to find all kinds of particles in different quantities in people's blood samples at baseline. And right away they saw some typical paradoxes, like the factors that caused death were different than the ones that caused non-fatal heart attacks. But when you hone in on what's taking people's lives, age and kidney function predominated. Beyond clinical markers, some biomarkers like small HDL and glyc-A that relate to inflammation, while citrate and some branched-chain amino acids like valine, leucine, and isoleucine, which are related to metabolic health and nutrition, played a large role. They categorized the first two as an inflammatory vulnerability index, and the last four as the metabolic malnutrition index. Now, IVX and MMX were potent predictors of mortality, but it turns out that nutritional health and inflammation are interactive, and when you multiply them together, you get a potent biomarker called MVX. And this single MVX number on a lab test from 0 to 100 predicts mortality better than age, particularly mortality in the next 5 years, but in the long run as well. And it's predicting mortality in multiple disease states like cancer, heart disease, respiratory disease, ischemic heart disease, stroke, COPD. It's adjusted for gender because men have higher numbers than women, although they also die at higher rates. Certainly, the higher the score, the worse the outcome looks. Now, the distribution of the score in different age groups is actually similar, even in 30-year-olds. And in serial sampling, it has been shown to change over time in some people. These findings have been replicated in multiple databases looking at hundreds of thousands of patients with different conditions. Other studies have shown how glyc-A can change with certain metabolic changes or bariatric surgery, and the next frontier will certainly involve testing what interventions can change MVX. Now, some would say they wouldn't even want to know anything about this test, and it is somewhat daunting at first glance. But meanwhile, today in clinical medicine, we track all kinds of disease states and do fancy new tests looking at telomeres for epigenetic clocks to try to generate things like your physiologic or biologic age in comparison to your chronologic age. But MVX can more powerfully predict whether you're going to be able to survive your next stressful episode, whether it's an infection, cancer, heart disease, stroke, or something else. So don't ignore it. You can check it even for cash pay for about $60. If the scan is abnormal, then buckle down on lifestyle strategies like avoiding tobacco, excessive alcohol, doing lots of zone 2 training, keeping the heart rate at about 180 minus age, lots of resistance training, optimizing protein intake and avoiding processed foods, and favoring more Mediterranean whole plant-based foods. And follow mindfulness meditation strategies to get plenty of good quality sleep. And stay tuned for the most advanced testing and treatments at High Desert Heart and Vascular.